Greetings, everyone. My name is Angel Rubert, and I'm part of the Social Determinants of Health Research Group, Group 1, for the Data Analytics course with Dr. Shang. For this project, we work with the census data file of 2020 and 2021. We covered 52 states, 3,110 counties, and 3,108 zip codes. We excluded U.S. territories such as Puerto Rico, Guam, and the Virgin Islands, just to focus on the US main states. Our goal was to explore how social determinants factors like income, education, sex, employment, geography influence chronic diseases and mortality outcomes. To do this, we built an interactive dashboard with three layouts, one for 2020, one for 2021, and one with a big picture comparing both years side by side. This dashboard was built to allow users to easily detect trends, relationships, and insights at a glance with interactive features that simplify exploration with just one simple click. I will now give you a general overview of our dashboard and why we select the visualizations that you see on file. I will explain that first and then go over each visualization and how the interaction goes with the user. So we have a map. This map represented 52 states. You can navigate either by region, it change as you click on the regions. If gives you the zip codes in each of the states. Also, if that's not enough, we also thought in a deeper analysis, you can maybe want to explore by state. You can do that also because we made the dashboard interactive by state too. So that's the maps and why we chose that layout for the main visualization of our dashboard. Also, we have a sample summary. As you see, we are able to navigate by regions, which was our main goal in this Power BI because we wanted to get the big picture by regions. Also, we had the median age field that tells us the median age by region or by state. Unemployment levels. Also, we have a bar chart. We have median house income by bar charts, also comparing by year, high school education, college education, the access of healthcare. Something that is very important to us was to detect and identify trends. For example, in those areas, it was very difficult to our states to get a primary care assistant. As you see in this visualization, is a radar. It tells you our data set is here, but our zip codes are here, but the primary care is far away from them. And we can compare that, for example, with the West, in where their primary care access is near to our data records. So we have that exploration and we can compare and see how the diseases change not only by year, you can see how they increase or decrease by year. I know our teammates have explained that in 2020 we have a pandemic named COVID, and that it's demonstrated in how we see the dashboard. There's so many cool features we have in our dashboard. We can also search by the year. We were talking about, for example, this one is for 2021. We can see how also our dashboard change, or we can explore if they are in a rural location or an urban location. We can see all the demographics like gender. We see more females in 2021. For example, let's go to 2020 just to compare that variable. See, females had been dominating the population in both census and so on. You can create trends, relationships just in a visual way and just a simple click with our dashboard. I will add more to what my peers had just stated. Basically, we have some analytical connections on this dashboard. Unemployment, poverty, and income. Higher poverty and unemployment correlate with more hospital stays and worse chronic disease outcomes. Rising income in 2021 helped reduce hospitalizations, education, Higher graduation and college attendance rates are linked to better utilization of health services and fewer avoidable hospitalizations. Urban counties benefit from stronger infrastructure and access to providers, while rural counties struggle and are with limited resources, leading to worse outcomes. Some regional outcomes or impacts that we also notice is that South is more vulnerable, higher poverty, more social security beneficiaries, and highest hospital rates. Midwest has a mixed progress. Hospital stays decline, but poverty and chronic disease rates remain significant. West has a strong resilience, um, lower poverty, sharp declines in hospital stays, better education, and healthcare access, as you see here in the picture of the radar. Northeast is most stable, lower hospital stays, stronger healthcare access, more equitable outcomes in the North State, and probably more education level too. In summary, our dashboard reveals how economic stability, education, and geography all interacts to shape health outcomes. Between 2020 and 2021, we saw progress, lower employment, higher income, and fewer hospital stays, but disparities remain, especially in the South and Midwest area. This dashboard doesn't just present numbers, it tells the story of a health equity in America. By understanding these regional impacts and why each visualization matters, we can design interventions that target the communities most in need and move closer to equitable health outcomes nationwide. Thank you so much for your time, and I hope you enjoy our dashboard and see how we can use small tools that the what we have in class, but we can do great things with the well-structured data and the time in a deeper analysis as we did in this team. Thank you so much.